Hi viewers, welcome to our tutorial series on evaluation. In our today's session, as promised in the first, second and third part of the tutorial series on evaluation, we will discuss case studies demonstrating application of evaluation criteria and components for a multi-sectoral project. In the past one, we discussed fundamentals of evaluation, why evaluation is important and what are the various types of evaluation with practical examples of evaluation in different sectors. Similarly, in the second part, we discussed key components of evaluation like evaluation criteria, evaluation question, data collection methods, data analysis and reporting, how to conduct evaluation while applying these components and criteria, and we also provided lots of examples from different sectors. In the third part, we discussed how to develop evaluation framework with the components of evaluation and UNEG evaluation criteria, and we also gave you some practical examples of evaluation in different sectors. These tutorials have been uploaded on YouTube. The links are given in the description and here also if you haven't watched them. Now in this part 4, we will discuss case studies demonstrating application of evaluation criteria and components for a multi-sectoral project. Let's start with our today's session. Don't forget to subscribe, like, share with your family and friends and hit the notification bell. In this case study, I will demonstrate application of evaluation criteria. Comprehensive evaluation of a multi-sectoral resilience program. For example, there is a multi-sectoral resilience program and we are going to evaluate that project. Program overview. The Integrated Community Resilience Initiative was implemented in a rural region prone to natural disasters and health challenges. The program aimed to enhance community resilience through education, health, disaster, and humanitarian assistance. You can see here that was a multi-sectoral, so that's why in education their goal was improving local education quality and health, strengthening health services, and disaster enhancing disaster preparedness, and in humanitarian providing immediate support during crisis. Now evaluation using UNEG criteria. There are 4 sectors in this one project. So how we will apply the different criteria to evaluate this project. Now here you can see relevance. On this part you can see the definition, the extent to which the objectives of our project are consistent with the needs of the beneficiary and content. So in the application and case study, what was the application? In education, assess the relevance of new teaching methods to local students-led initiatives. Health, evaluate if health intervention addressed prevalent local disease. And DRR, ensure disaster preparedness activities were aligned with the community's specific risk. Humanitarian, verified that aid provided met the urgent needs of disaster affected population. So for all these 4 sectors in the same project, this would be the application of the relevance criteria. Let me explain it a bit more. In education, conducted a need assessment with local teachers, students to tailor the new curriculum and teaching method, focused on addressing gaps in literacy and numeracy that were identified as critical by community stakeholders. So this is one of your relevance criteria application in education. And health, implemented health intervention based on epidemiological data showing high rates of infectious disease, prioritize vaccines and health education programs relevant to the community's prevalent health issues. Similarly, in DRR, we designed disaster preparedness activities based on a local risk assessment, identifying flood and earthquake as primary hazards. Activities included building flood defenses and earthquake resistance infrastructure. In humanitarian, adapted emerging relief plans to the immediate needs of community affected by a recent cyclone, ensuring timely distribution of food, water, and shelter. Now, when you are applying coherence criteria, so here the compatibility of the intervention with other intervention is in a country, sector, or institution. So in education, evaluated the alignment of the program with national educational initiative. Health assessed coherence with existing health initiative. NDRR checked compatibility with regional disasters management strategies. And humanitarian ensured alignment with other humanitarian organizations. In education, we ensured the new curriculum and teaching methods aligned with the national education reforms and policies, enhancing coherence with broader educational objectives. Health coordinated health intervention with existing regional and national health to avoid duplication and ensure complementary action. DRR integrated disaster preparedness activities with regional disaster management plans and strategies, promoting synergy and shared resources. And humanitarian collaborated with other humanitarian organizations to ensure efforts were aligned, avoiding duplication and maximizing resource. Now, while applying the next criteria, which is effectiveness, the extent to which the objectives of a program or projects are achieved, including any differential results across groups. In education, we measured improvement in student literacy and numeracy. In health, evaluated reduction in disease incidence and improved patient outcome. And DRR assessed community participation in disaster drills and increased preparedness level. And humanitarian reviewed the adequacy and timeliness of humanitarian aid delivery. Evaluated effectiveness through pre and post tests showing significant improvement in student performance and engagement after implementing the new curriculum. And health collected health data indicating a substantial disease and disease incidence and improved health outcomes after the introduction of community health program. And DRR conducted drills and simulations demonstrating increased community preparedness and quicker response time in disaster scenarios. Now, for the impact, we have the broader long-term changes produced by a program. So in education, maintain the long-term educational attainment and career success of students. Health evaluated the sustained improvement in community health indicators. And DRR assessed the long-term reduction in disaster-related losses. And humanitarian measured the recovery and resilience of community post-intervention. Track the long-term educational outcomes such as increased graduation rates and higher rates of university admission among participants. And health monitored long-term health improvements, including reduced mortality rates and better management of chronic disease in the community. And DRR evaluated the long-term reduction in disaster-related economic losses and improved community resilience as evidenced by quicker recovery time after events. Now for sustainability, the likelihood that the benefits of project will continue after funding. So in education, evaluated the capacity of local schools to maintain improved teaching. Health assessed the ability of local health system to sustain improved services. And DRR reviewed the integration of disaster preparedness into community practices. Humanitarian analyzed the establishment of local support network for future crises. In education, assess the ability of local school to continue using the new curriculum and teaching methods without ongoing external support, including the integration of training into local teacher development. Then in the health, evaluated whether the health workers were able to maintain new health practices and continue delivering improved services using local resources and knowledge. And DRR reviewed the integration of disaster preparedness practices into daily community life and local governance, ensuring ongoing commitment and resource allocation. And humanitarian analyzed the establishment of local network and resources that could provide rapid response in future crises without a reliance on external aid. See you in the next video, part 5, in which we will discuss practical steps, best practices and strategies for effective evaluation. In that session, we will discuss what are those practical steps, strategies and best practices for effective evaluation and difference. Part 6, we will discuss challenges in evaluation and how to overcome those challenges. And then in part 7, we will discuss ethical consideration and evaluation. Also, already uploaded 2 video tutorial in this series. In this first one, we covered some foundational aspects of monitoring, evaluation and research. And in the second one, we discuss monitoring in detail. If you have not watched these videos, so the links are given in the description. If you visit our channel, so you can find lots of YouTube tutorial and playlists on monitoring, evaluation and research, what is monitoring, how to do it, designing logical framework, result framework, theory of change. Similarly, we have playlists of Microsoft Excel learning data analysis function. So there are lots of tutorial on data analysis, how to do. There are lots of tutorial on how to do online data collection with Kobo, MS Form, Google Forms, online data collection tools, Kobo. You can improve a lot of your skills through easy ways to collect online data and analyze that. Similarly, ChatGPT and other AI tools, MS Access. If you want to learn Microsoft Access, so there is a detailed tutorial on MS Access and SPSS, and similarly other tutorials that can benefit you a lot. We also provide one-on-one session if you are interested to learn about any of these topics. Here you can see the WhatsApp number or Skype ID, email address. You can contact us. We provide one-on-one sessions also that we can discuss through WhatsApp or email. Don't forget to subscribe, like, share with your family and friends, and hit the notification bell.